By all accounts, Dr. Teresa Tam says the third wave is upon us as provinces across the country grapple with COVID-19 and the variants.
Variants of concern are contributing to the current resurgence. The B117 variant is known to cause more severe illness and increase the risk of death.
Dr. Tam added that the B117 now represents over 90% of new cases in Canada. In Ontario, over 3,200 cases were reported in just 24 hours. And with 500 patients now in ICU, these cases have prompted the government to announce stay-at-home orders across Ontario.
This variant is moving hour by hour, day by day. So we have to move with it and be nimble and be quick.
Starting Thursday, April the 8th, for the next 30 days, only essential stores will be open, like grocery stores and pharmacies. Big box stores will be limited to essential items only. Non-essential businesses will be eligible for government assistance, and sick pay for workers is available as well. In places like Alberta, variant cases are now making up nearly a third of all new cases.
Our reproductive rate that shows how quickly the virus is growing or spreading is higher for the variant of concern cases than it is for all of our cases together.
In Saskatchewan, First Nations communities are now holding mass vaccination clinics to stop the ever-increasing numbers of cases in that province. Along with Ontario, British Columbia is also now considered a hotspot in variant cases across Canada, with over 1,000 cases since April 1st.
Let's ensure we don't lose any more ground. We can get through this surge as well.
The variants have also crippled the Vancouver Canucks, with 21 players, coaches, staff, and their families testing positive with the P1 Brazilian variant, essentially showing that despite your best efforts, no one is fully protected from the more transmissible variants. Chief Don Tom says he is very concerned.
I think the concern is that it not only impacts elderly, but it's also, we're seeing an uptick in younger people being hospitalized. And so I think that's a concern that maybe those who felt that the concern or the impact of the virus, maybe it wouldn't affect them, that we're beginning to see a trend that it is affecting all ages now.
Back in BC, Dr. Shannon McDonald says she wants to keep encouraging people to get vaccinated.
The vaccines were really meant to prevent hospitalization and death. And that's what they're doing. They've been very, very effective.
Tina House, APTN National News, Vancouver.